There are a lot of health myths out there, and some can actually be dangerous to your health. Here to dispel some health myths is Dr. Shad. Doctor, thank you so much for being with us.
My pleasure. Thank you.
We've heard that fat is good, fat is bad. So tell us, which is it?
The answer is that fat is good and bad, and it depends really on how you prepare the fat, where the fat comes from, and what kind of fat it is. So let's start with what is good fat, because for many years we thought that all fat was bad. And the reality is that when we had a head-to-head study from the American Heart Association, at that time low-fat diet versus the Mediterranean diet, the results were so impressive that they actually had to stop the study in the middle of it because the people in the Mediterranean diet group had such great benefits for their heart, with less heart attacks, less strokes, lower blood pressure, lower cholesterol, and they were just doing so well that it was unethical to continue the study. And so what we learned from that and subsequent research is that there's good fats that we need actually. Fat is a critical part of heart health, brain health. Every cell in our body needs fat. The question is what kind of fat? And the best fat is actually plant-based fats that come from nuts and seeds, avocados, and then also followed by that is fatty fish or omega-3 fish oil. Obviously extra virgin olive oil is a plant-based fat that's also really good. Bad fat is actually processed fat. Fat that is like hydrogenated oils and other kind of ingredients of solid fats that are in processed foods.
Now, doctor, 10,000 steps. Is this the magic number per day that we want to achieve to maintain our health?
10,000 is definitely great, but it's not the magic number. You can actually get many health benefits from even less steps than that. 10,000 actually came from a Japanese company that started pedometers in 1965, and it wasn't really based on any scientific studies. In fact, there's been many studies that have been done, one in particular with over 16,000 women, where they looked at their steps and they found that even with 4,400 steps, they had a 41% decrease in mortality. And if you increase that to 7,500 steps, that was a 65% decrease. The bottom line is just move. Even taking some steps as little as 4,000 steps a day can have a big impact on your health.
Now, Dr. Shad, when it comes to sleep, is it true that we need 8 hours of sleep per night?
It is not true for everyone. It depends on what age you are and what medical conditions you have. So earlier on in life, we actually require much more than 8 hours. And as we age, the number of hours that we actually need for sleep actually decreases. And that has to do with the cycles of sleep and how quickly we're able to get into what we call rapid eye movement or REM sleep. And as we get older, the period of time that it takes to get there actually decreases. And so you actually don't need as much sleep. Now, that being said, we definitely have a problem with sleep deprivation in the United States. And a lot of that has to do with poor sleep hygiene. And I would encourage everyone to look up sleep hygiene and what you can do actually to program your brain to actually be able to fall asleep better. And so I would look at how much sleep you are getting because most of us probably aren't getting enough.
Doctor, thank you so much for your time. We appreciate you. If you'd like more information about Dr. Shad, head over to his website.